Okay, I'm going to call to order an emergency meeting of Haywood County Board of Commissioners. Today's date is March 26, 2020. And first, we will be considering today an amendment to the Haywood County proclamation of a state of emergency. And I'll have our county attorney, Frank Queen, explain this in just a second.
He's misplaced his glasses.
Okay. Did you want to say anything, Brian?
He's got a short presentation to explain the workings of this proclamation. I think he'll be right here shortly.
Okay. I want to say I appreciate everybody meeting on such short notice. We have noticed this per North Carolina General Statute 153A-40. Says this emergency meeting was properly noticed and gives a call to order of the Board of Commissioners, and no other business can be discussed during this meeting. I appreciate all the commissioners making time out of their schedule to come and do this. This is a decision that I could probably make on my own, but I'd rather have everybody's input in a board setting to be able to do this because I think it's really important. And I think there's a lot of facts that we need to kind of wade through and consider this morning. And so I'll go ahead and turn it over to Frank, if you would, Frank, and go ahead and explain.
Thank you, Mr. Chairman and Commissioners. Earlier this week, the governor announced that he was probably not going to issue, at least not at that time, a stay-home order or a stay-home amendment to the declaration of emergency at the state level. That triggered off a series of county decisions all across the state. The stay-at-home proclamations are technically an amendment to your declaration of emergency, your local declaration of emergency. You'll recall that the governor made a proclamation, a declaration on March the 10th, and is my recollection of the date. And then that was followed by various and sundry local jurisdictions passing their own local declarations of emergency. A declaration of emergency triggers off a series of legal rights that devolve to the government unit that makes that proclamation certain powers and authority to control businesses and to direct the lives of their citizens in ways that, absent that emergency, you can't do. You don't have that authority or power. So the local declaration of emergency devolves some of that authority to local governments, and local governments all across the state have made many of them, not all of them actually, but many of them across the state, passed local declarations of emergency to start the operation of their emergency operations centers, to carry out the plans that they'd made, like Haywood County had made, to plan for different kinds of emergencies. Earlier this week, or very late last week, Mecklenburg County made the first comprehensive stay-at-home proclamation down there. That was a long and very thoughtfully prepared document. Many other counties across the state have since started to adopt, in either greater or lesser degree, something like the Mecklenburg Declaration, because the Mecklenburg thing covers a lot of issues that are very, very common to different counties and towns across the state. For example, day before yesterday, or maybe even yesterday, Winston-Salem passed essentially the ordinance that I've drafted for Haywood County purposes that is modeled on the Charlotte Declaration, okay? So this is a very detailed document, but it is thoughtfully prepared by a variety of different levels. It's also been modified for local conditions that we've gone through with our local stakeholders in county business enterprises across the county. We've been, the county manager and you all have been invaluable in providing input to us about what makes sense for Haywood County, what makes sense for Haywood County residents. And this proclamation's been amended and modified to take into account a lot of those local concerns. The essence of a stay-home order is a public health concern. If we can reduce the speed of the transmission of the virus between the members of the population, you can slow down the impact of the sickness on your healthcare system. An epidemic ends, a pandemic ends when you achieve herd immunity. Herd immunity is about 70% of the population has either been inoculated with a vaccine, or they have acquired the illness and their bodies develop their own antibodies that now make them immune to the illness. It takes about 70% of the population having acquired herd immunity to the disease before the disease ceases to propagate uncontrollably. So the object of the entire planning for an organization and a governmental unit and a population like Haywood County, which does not have, at the present time, as far as we know, a great number of cases. We've got a lot of tests. The public health director is doing more tests every day. But we know just based on common sense that we're going to have, and we do have, the virus in this county right now. We may not have a positive test result, don't know. Takes a few days to get those back. But in any case, we're at the place in a pandemic that if we can slow down the passage of the virus from one to another, if we can slow it down, then we can retain the capacity of our healthcare system to deal with those serious cases that make their way into the healthcare system. Economic activity unquestionably will suffer. It already has suffered, and I think the line from Dr. Fauci at the federal government, who said, "We don't set the timeline; the virus sets the timeline." Okay, what we're doing is reacting to it and trying to slow down the transmission of the virus between the members of our population. The basic structure of this proclamation is that everyone who can stays in their home. Best piece of advice I ran across yesterday was, don't try to figure out a way to get out of your home, try to figure out a way to stay away from others. That is what will slow down and give us time. Non-essential businesses under this proclamation close. Non-essential travel ends. In the essential businesses, and there's a long list of essential business functions that are allowed to remain open and to function, they are to try to reduce operations to something called the minimum basic operations, and that's defined in your proclamation. That's basically the operations that are only those operations are necessary to preserve the business as an ongoing enterprise. Travel. Leaving home for essential activities is permitted. That is for health and safety, that's a defined term in your proclamation. For necessary supplies and services, that's a defined section in your proclamation. For outdoor activities, that's a defined section in your proclamation. For essential businesses or operations, that's a defined section in your proclamation. And to care for others. Those travel purposes are permitted, okay? Remember, we're back to the initial thing, which is non-essential travel is prohibited. But these are the definitions of things that are permitted. Work travel is permitted in these circumstances. One, to get or give health care and public health operations. That's a defined section in your proclamation. For human services operations, That's a defined section in your proclamation. For work at essential infrastructure jobs, that's a defined section. And for essential governmental functions, again, that's a defined section in your proclamation. Each of those kinds of travel is permitted. When you start to look through this list, you'll quickly say, well, what's prohibited? If all these things are permitted, what's prohibited? What's prohibited is doing like a whole lot of folks do when there's a snow day around here. They get in their pickup trucks and they go out and do donuts out at the Ingalls parking lot, okay? You can't have casual travel and casual getting together. That's what is prohibited. So if you're undertaking essential activities and essential travel, that's going to be permitted. Hosting a parking lot get-together is not permitted. That is going to get people inside their social distances. That's going to get people in positions where the virus can spread from even someone who doesn't know that they have the virus to people who can become infected. Travel and work at essential businesses and operations is permitted. The list of essential businesses operations is 22 categories. They're in elaborate detail. Employees and the customers of those essential businesses and operations can travel to and from them, and customers may go to and from those essential businesses and operations. But even essential businesses are required to operate minimum basic operations, and that's a defined section in your proclamation, and defines how you maintain social distancing is also in your proclamation. Changes in business operations are going to be required. This is a piece that probably hasn't a lot of attention been paid to as we sorted this out, but it is it's actually very important. One of the places that remain open that are essential businesses are grocery stores, places where you're buying food for your family. That kind of business is an essential business, but that business has to adopt these kinds of social distancing aspects, marking out, for example, 6-foot distances in the checkout line. Now, I go to the store at weird times just because it strikes me at odd times that I need something. And so often I'm there, there's nobody else there, okay? Or there's nobody in the line. But if you're in line, this ordinance requires that that grocery stores and other businesses that have a line to get to a cashier mark out on the floor, mark out in some fashion, put up a little thingy there that people can see this is 6 feet apart. By the way, how far is 6 feet apart? 6 feet apart is the average wingspan of an adult in the United States is 5 feet 11 inches. That's from this fingertip to that fingertip. Basketball players are much longer. Me, not so much. But if it's 5 feet 11 inches, call it 6 feet, then from the center of your nose to the end of your fingers, 3 feet. If you can't touch fingertips with the person next to you, you're at social distance, okay? That's social distance. You don't need a thing marked out on the floor. If you can't touch fingertips with the person there, you're at social distance, assuming, that's about 6 feet. So, changes of business operations, mark out to enforce social distancing, put up hand sanitizer, assuming that the customers don't steal it, separate the operating hours for vulnerable populations, and facilities post information for online or remote access to the business. Pretty much, we've seen lots of this stuff already done. The separate operating hours for vulnerable populations is fairly easy to institute. And there's some debate about whether that is the right thing to do, but that's what the ordinance says, and that's the best advice we've got so far. Your ordinance contains couple of sections that are not in the proposed ordinance. My draft of this ordinance contains several sections that are not in the Mecklenburg ordinance, that are not in the Forsyth ordinance, or any other based on those other ones. We've inserted a special section for those who are returning to the county from outside the county for 7 days or more. That is, the person's been outside the county for 7 days or more, they're returning to the county. Maybe they have a house here, maybe they've just been on, who's been on vacation in the last month, but anyway, they've been somewhere else and they're coming home. College student, okay, a college student who's coming home, or anybody else who's coming home. Returning residents are required to self-quarantine for 14 days. Now, that's your best public health advice on that. That should cover a person who's been exposed, didn't know it, acquired the virus, didn't have any symptoms, and got over it and stopped being a virus shedder. All of that should be able to be taken care of in that 14 days. Okay, so this is having self-quarantine from the people who come back into the county from somewhere else when they've been gone for 7 days or more. It's that 7 days or more is utterly arbitrary. It's just, you got to pick some date that's recognizes people might be exposed somewhere else. They come back. You want them to, you were trying to get the population of carriers. You're trying to isolate the population of carriers, even silent carriers who come back into the jurisdiction. You're trying to get them to get in a position where they can monitor themselves. They can follow the CDC. And here's the third section there. The self-quarantine guidance of the CDC will be adhered to by the returning resident. That website thing there is a very, very sensible, extremely short, well-written one-pager on the CDC's website that describes how to govern yourself when you're in a home-based self-quarantining situation. So that's a very useful link for people to refer to. This is a section that was just slugged in about an hour ago, and I think the managers had got some survey information that he'll want to bring up about this. This is special rules for hotels and short-term lodging. The Mecklenburg and the Forsyth proclamations, declarations, don't have any limitations on hotel or short-term occupancy. Okay, they don't. They in fact describe hotels and motels as long as they're not being used for lodging or takeaway food. They're permitted businesses. Okay, and that's what Mecklenburg and Forsyth and the other counties that have adopted this have done. I understand, I haven't seen, Buncombe County may have put on a limitation on hotels and short-term lodging. You guys probably know more about that than I do because you've probably been paying more attention to it than I have. We put in a section here that essentially says that motels and short-term lodging can be used in the support of essential activities, but not I guess you'd call leisure activities or unpermitted activities, things that are not permitted in the rest of the ordinance. And this also has a self-reporting provision that says you'll notify the county's COVID hotline. That's a new number. That's a new service that's just been rolled out to list place of travel, length of stay, and purpose for travel. The idea is to have self-reporting of potential vectors, potential carriers of the virus, to at least have that kind of information on them. That's the end of how you can do a slideshow in 45 minutes. You've got the text of it in front of you. Let me answer questions that you have, and then the manager didn't you get a poll, I think just an hour ago, about what the lodging people what their thinking was?
We actually asked Lynn to be here to talk about this because we understand we're fighting a public health crisis as well as causing economic hardship. So Lynn actually did a poll for us over the last couple of days, and she has some results that she can share with us, if that pleases the chair.
Thanks. Good morning, Commissioners. I think each of you have a copy of the survey results that we did yesterday afternoon with our accommodations. This was sent out to a total of 72 companies, and the responses are generated from hotel motels, both independents and chains, B&Bs, resorts, vacation home rentals, cabins. So there really was a good range of all types of accommodations that did respond to this. So as you can see, has your accommodation rented rooms in the last week? 59% said yes, 41% said no. And then we ask about what states. You can see we put in there some of the most critical states, and the majority came from other. There was a small percentage from Florida, a little larger percentage from North Carolina, and all the others were listed as other states that they were coming from. We then asked, would it be beneficial for the county to mandate closing accommodations? And then we went on to ask, if so, why, in your opinion? And it was about 55% said yes, about 45% said it would not be beneficial. And then it went on to have answers to the question as to why they felt it would be beneficial. So you can read those, and I think they're all pretty much on the same page. And then we do have some accommodations, some hotels that actually have taken it upon themselves to go ahead and close. I know of 4 properties, good-sized properties, that have decided to close and have been closed for several days now. The next question, would it be detrimental for the county to mandate closing accommodations? 60% said yes, and 40% said no. And in looking at the answers to that questions, even though these folks, some of these folks said no, it was sort of no, but. Said, basically is, would be harmful as far as the economic piece of it went, but they do understand the importance of not spreading the virus. So I think in looking at these answers for this particular question, I can tell you that we do have owners of vacation rentals here that are staying in their properties. We have had a lot of calls from owners inquiring about coming, and we have asked them very kindly not to. We still are getting calls wanting to know if we're open, but it's not, most of those calls are not people who are wanting to make April. And so a lot of those folks obviously are looking at making changes to their events. So we have been working with all those event folks and trying to encourage them to reschedule at a later date during the year, as opposed to just simply canceling the event and not having it at all. Because we know when we are able to open back up, we need the people to come and visit us. We need that to be part of the recovery process at that time in the future. I am doing daily webinars with the U.S. Travel Association and Destinations International. The U.S. Travel Association has been the one that has been at the White House negotiating to have travel included in the package that they're trying to get passed right now so that there will be some funding available for the travel industry. So we are monitoring those changes on a daily basis, and hopefully, if and when that gets approved, we will be getting that information out to our tourism industry partners and how they might can take part in that. We also are sending out newsletters to all of our tourism industry partners on a daily basis, keeping them updated and informed about the situation as it stands and as we know it to be. Also providing resources to them that have already come out as being available for potential assistance with their business as we move forward. So with that being said, I'll be happy to answer any questions you might have.
Just a comment, I caught where you said you had kindly told them no during this time. I appreciate that, to try to limit, mitigate this virus that's going around. And I was looking at all the comments, and it kind of mirrors, what the amendment to our proclamation says. Some of your people even said, they're open to just about everything that we put in this document. So, and in planning for this and discussions I've had, we have to consider maybe having an emergency on top of the emergency we have. And I know any emergency management team has to consider a worst case scenario. If we had a spring blizzard, which I can remember several late season spring blizzards, or a weather event where we had power company workers mustered in here from 3 or 4 states to try to repair our power grid, we would want the ability to house those folks. And I think there's provisions in this proclamation to accommodate that and focus on the item at hand, and that's to mitigate this COVID-19. So I appreciate your comments, and looks like all your people kind of mirror what we don't like it, but we know it's necessary. So thank you.
We will tell you this. We obviously have the visitor center closed. It's been closed for a few weeks now, but we did set up a brochure rack out front, so they had information they could pick up if they chose to stop. And our traffic had died off about a week ago, but yesterday it was really busy again, and I thought that was interesting that we had that slow down. And then yesterday, and all the cars that stopped, we do check their tags. They were all out-of-state cars.
And I think we'd ask, I know some of these accommodations say that, well, I guess 59% had rented in the last week and 40 hadn't, but a lot of those accommodations have more than one room. And so they
Yes,
probably
absolutely.
rented maybe one and not, 20. So I know you had said that our occupancy tax is to expect it to be down probably 90%,
If not more.
if not more. Okay.
And the kind of the unknown is in this is we did send this survey to the local property management companies, but
Oh,
there
okay.
are so many vacation rentals out there that are either with VRBO or Airbnb or even rented individually, and we did not send to all of those folks. So that's sort of the unknown factor in this, in that there are people here in a lot of those houses, that we just simply maybe do not know are here right now.
Anybody have any more questions for Lynn?
Sounds like it's already shut itself down more or less.
Yeah.
I mean, for the most part. Those that I know that we spoke to said that they only had 1 or 2 of the rooms in a larger hotel that were occupied. So, and looking at these numbers, looks like it's basically taking care of itself. Thank you for putting this together for us.
Yeah, Lynn, I know it took a lot of work, and I appreciate you and your staff doing it, getting this information to us.
Thank you.
And so that way we know what the facts are. Thank you. Okay, Brian?
I think Lynn's survey is important because yesterday we had conversations that there's the idea that a lot of folks from New York, New Jersey are coming here. This didn't reach everyone, as Lynn admitted, but out of all the responses, there's nobody that had rented a room to someone from New York, which is the hotbed. So I think that idea's out there, but we don't have data to support it. And I haven't seen a whole lot of New York vehicles around.
I had a property that called me and told me that somebody stopped by their property to rent a room, and they were from New York, and they didn't rent to them. So,
They're kind of policing themselves, sounded like. Yeah. Okay, so we'll consider the proclamation.
The only thing that, beyond the text that you have in front of you, I didn't have a start date time in it, and I don't have, I'm trying to remember how much I kept of the end time of it.
So
This one has it valid through April the 16th. That's just random. That it's actually probably came from the Mecklenburg proclamation. So that's on page 12. You might want to consider that. The other thing that you've got on it is you've got a blank above the chairman's signature line for when it would be to take effect. You've got to think about, you're doing some fairly drastic behavioral modifications for the population, and you need to consider appropriate start time, and then decide whether or not you're going to keep that April 16th date for the end time. Of course, you can always amend this, and as the chairman pointed out, emergency proclamations are made and can be made. You're authorized to be made by state law by the chairman, acting with or without a meeting. This emergency meeting was to publicize the nature of it. This is a very extensive set of behavioral changes we're trying to impact across the county, and so you need to consider that for both your start date and your end date.
Right, okay. Does anybody, okay, let me ask this, other than the lodging, we'll get into that in just a second, but other than the document itself, does anybody have any changes or questions about that?
Other than us talking about the lodging?
Yeah, I know we need to talk about that.
Okay.
Other than the lodging, I mean, because we'll get to that in just a minute, I guess that's the way to do it. The document itself, is everybody pretty well in agreement?
I've got some questions,
some.
Mr.
Okay,
Chairman.
yeah.
Or if Mark wants to go first.
It doesn't matter.
One of the questions I had, I know that we're saying if a resident is outside the county for 7 days or more, and I guess I'm a little concerned about that. Why 7? Seems like that time frame ought to be shortened up to a shorter amount of time. I mean, 7 days I can understand if somebody's going on vacation, but somebody shouldn't be doing that during this time. If they do, then I think they need to be included in the self-quarantine. So the 7 day I have a question about. I don't know how you guys feel about that, but I feel like it should be shortened up. And also, I guess another question I would have is I know that the alcohol part is in here, and I have had a lot of constituents that have contacted me that have been concerned about shutting a hair salon down, but leaving these type of things open. So I assume that that's because of the state proclamation that was handed down. I see Mr. Moorhead.
The governor took action on Monday that shut down hair and nail salons and the like. So that's not part of this because the governor's already closed those facilities.
Exactly, but I know the alcohol part is still in, governor handing that down as well.
Alcohol sales are preemptively regulated by the state ABC board.
All right, okay.
And so
That supersedes us. anyway.
nothing that we would do can have any effect on that except the sale of alcohol on county property, and we already are prohibited to regulate that. So the regulation of alcohol sales is preempted by the state, and all facilities that can sell alcohol are required to follow ABC rules.
Okay, thank you. That was back to my station, but I wanted to bring that out in the open, number one, and make sure I was correct. And then the other thing is just the short term that we're going to discuss here in a minute. So I guess my other question was the 7 days.
Well, and that was something I was going to have a question too, and Patrick might be able to help us. Everything has an incubation period, and I'm not sure that we know exactly what that is, if he knows. Well, the incubation from the time someone's exposed to someone who's affected before they end up showing symptoms.
Anytime within 14 days. So the incubation is a 14-day period. So when we quarantine anybody or isolate anybody, we're asking for a 14-day time period.
Patrick, what's your opinion on the 7-day period? What we're saying is if a resident inside the county goes out of the county for 7 days and then returns, we're going to make them self-quarantine for 14 days. But if it's 6, 5, 4, 3, or whatever, we're not going to do that. I think personally that time frame needs to be shortened. What's your opinion there?
I wasn't consulted on that time frame, quite honestly. I didn't see that until this morning.
It wasn't that, as I explained when I did the presentation, it's an arbitrary date. What you have to concern yourself with is this: people who work away from here and who are working away from here for 5 days, okay? They're working away from here and they come back from their work, okay? It's essential work. When they come back, then your proclamation as it's currently drafted requires them to self-quarantine for 14 days. So if you had a person who worked away from here for 5 days then they would not be required to self-quarantine for 14. Right. But if they were gone for more than 7 days, then required quarantine for 14 days. That means that they can't go back to work.
Right,
whatever that
I
job
understand
was.
that, and I understand the importance of them being able to do that, and I'm okay with that. The question is, I personally feel like if they've been gone for more than 2 days, even, that they need to self-quarantine, because somebody that goes outside the county could bring the virus back in. I guess it's just, I don't know how you guys feel
Well,
about
I
it.
mean, I can see your point, and I guess it would all depend on where that person went. If that person decided to socially isolate back here on the top of the mountain somewhere for 2 or 3 days, I guess he technically would fall into that category if he went out of the county. So I guess it would tend to be
Patrick had something.
We're still asking everyone to self-monitor regardless. Everybody should be, with this proclamation, everyone is going to be self-monitoring for any type of symptoms. This is taking social distancing to suppression, which is the next level. And so everybody should be watching for symptoms. So if anybody leaves the county and comes back, they should be self-monitoring.
But actually, they should be self-monitoring whether they leave the county or not.
Absolutely,
If I
that's what I'm
go to
saying.
Clyde, if I go to Clyde, I need to be as attentive as if I went to Candler.
Absolutely.
There's nothing magic about Clyde or Candler.
No.
I need to be aware of temperatures, cough, the usual things that we've been hammered into us.
Yes.
The object is to not make all of your citizens who work outside the county lawbreakers. The minute they take a job outside the county, even doing essential work. We have lots of nurses who, for example, do shifts, multiple shifts, and may be called upon to do multiple shifts outside the county. And to make them lawbreakers by a stroke of the pen here is bothersome.
I understand what you're saying, and I know that we're going to have folks that go to Buncombe. We have a lot of our Haywood County residents that travel to Buncombe, but typically it's for 1 day, or they come back same day. I know that there may be times with multiple shifts, they may go 2 or 3 days, but it seems like for the most part, what we're doing is opening up. If somebody travels to New York, as long as they come back within a 6-day window, we're not going to self-quarantine them. And
No, if they travel to New York, they're automatically going to come back and they should be quarantined for 14 days. Travel to New York, Washington State, and Louisiana right now, we're asking folks.
yeah, but where's that at in here?
Oh, I don't.
It's not in the ordinance itself. It's guidance from the CDC.
Yes.
and that would supersede this.
Well, violation of this ordinance, this proclamation is a crime, class 2 misdemeanor, 60 days in jail or $1,000 fine. Violating the CDC's guidance is stupid and it subjects you and your family members to being infected with this virus. So which is more powerful? The fact of the matter is that the ordinance is the power of law brought on to bear on the behavior of your citizens. And so you be careful when you impose the will of the state on people by ordinance.
You said someone would show symptoms within the 14 days.
They should, yes,
Do
sir.
you is there a minimum? I know every illness is different. Do you know if people are showing 4 days, 5 days?
I don't know, no. I haven't heard that, no.
So anytime during the 14-day period, they can develop symptoms. And
Correct.
the right thing to do is to stay home when you develop them. But we wouldn't be here if people stayed home. We wouldn't be sitting here today. The first order would have been enough. So I'm kind
Absolutely.
of with you, Brandon. I think shortening that time frame up is
Right.
the real thing to do. And some of the areas, adding the language for the areas so that it is enforceable for the areas that are hotbeds.
You could always, if you wanted to adopt it as it reads now, it doesn't have any geographic connectors. But if you wanted to amend that from time to time by action of the chair could amend this proclamation. Again, doesn't require a meeting to do that. And he could vary those places and even insert places into the proclamation.
I want to remind everybody, this is being streamed live on Facebook and YouTube, so this is part of our new,
Have they designated a name for, for certain areas that have more COVID-19, like New York? Is there a name designated for those areas?
I've not seen it.
Are they
CDC
called it?
hasn't announced it.
I know we said hotbed a minute ago, but have we designated a name for?
Well, we've been told that anyone traveling from New York to anywhere in the United States should quarantine for 14 days. I know that Louisiana now is a state that is a, in quote, hotbed, and actually Washington State is a hotbed. We've had phone calls from people from Washington State, and we have discouraged a traveler from that state. We've had people who have arrived here from New York, and we have advised them to quarantine for 14 days. When they give us their information, we call in with them on a daily basis. We are notified about travelers from outside the United States by DHHS Raleigh, and we monitor them on a daily basis.
It would be more simple to just do it for anybody traveling outside North Carolina, because we don't know where the next one's going to be. It could be Pigeon Forge. You have no idea. And then that way we don't have to try to add names to it or anything like that, and then decide what an appropriate time for them to have been outside of North Carolina. Because everybody in North Carolina is supposed to be following the governor's recommendations and his orders.
Yeah, that's a good point. I mean, I'd be okay with that. I mean, if we done something, anybody that travels outside of North Carolina. Other than that, it would follow the CDC guidelines, which says if you've been out of if you've traveled to one of these hot spots, I guess as you call it, you have to self-quarantine. So I'd be fine with that.
Yeah, it's scattered out all through the document following CDC guidelines. And I know one here sticks out to you on page 3 is regards to nursing homes and long-term care. But if these CDC guidelines change, which they are changing, I mean, they may have changed before, since we've convened the meeting. It says Haywood County will change automatically and accordingly. So this is kind of a moving target on a lot of this stuff. Move forward.
I was trying to write out something while you guys were talking. So what if we said residents who are returning to their home in the county from outside the county after an absence of more than 3 days for a non-essential business or operation, or are returning from, and I was putting the areas down, but we could say, or are returning from outside the state of North Carolina. Of course, you get, okay, first, then go on to say, or to comply with the self-quarantine. So that means that, if you're out of the state for an essential business purpose and you're returning, you're exempt from that. You still have to abide by the rules, but you're exempt. But if you go out of the state for more than 3 days for a non-essential business purpose, that means you're just going somewhere to go somewhere. Then when you return, you've got to quarantine. But if you go out of Haywood County and you go out of the state for business purpose, then business purpose, they don't have to come back and quarantine. I mean, you still gonna have to abide by all these same social distancing and things that Patrick have talked about, but at least one, it curbs our residents from leaving to go to places that right now could possibly they could get the infection.
Some countries, when the resident leaves, they're not even allowed back into the country. I work with a fella that's married to a woman in another country, and they were going on vacation here about 3 weeks ago in Thailand, and they canceled their trip because they had told her she could not enter back into her country if she left. There's some really there's some very heavy restrictions out there.
Yeah. I mean, does that make sense? Do you understand what I'm saying?
The one thing that I would recommend, and Patrick said this about 4 or 5 weeks ago, putting North Carolina in there, I'm not sure, because we have Wake County and Mecklenburg County that are growing in cases. This is changing so quickly. Anything we put in today may be outdated by this afternoon. I think
Okay, well,
that's where
then-
we kind of leave it open-ended and followed guidelines either from the state public health or the CDC about where places should be. The county and state lines don't really matter in this as much. And we need to have, if we're crafting a policy that's going to be in effect for a month or so, we need to have the flexibility to react accordingly.
Okay, so my other language then was, before we started talking about that, was, or are returning from an area deemed and nobody else could come up with anything else. So I said quotation marks, hotbed, quotation marks, for COVID-19, such as New York, New Jersey, Washington. You could list, multiple places, et cetera. I mean, they're deemed like that, so.
Well, I just have one more message. The virus doesn't magically jump from person to person. The better that people understand social distancing, and what I think we need to add the term suppression at this point. So people shouldn't be traveling right now. That's what we need to emphasize more than anything. The better people social distance, the less likely the virus is going to spread from person to person. So that's what people have to understand. When we say people aren't taking it seriously, if they are doing this travel business, if we have to just be careful with the travel business. Like Bryant is saying, out of state or Mecklenburg, it's almost the same thing, because Mecklenburg is the hot spot in the state of North Carolina right now.
Okay, so do you want to say if you travel outside Haywood County for more than 3 days?
That's the only way to cover it.
Then all you would do is change on page 11, then where you say, after an absence of more than, instead of 7 days, if you insert some other day number there, and then that requires a self-quarantining period. The second paragraph of that goes further to say people who have symptoms or been exposed or who have traveled in an area of widespread activity need to self-monitor their health. So in that CDC guidance, twice daily, temperature taking, separation from other people in the household, and so forth. So the only thing you'd have to change if you wanted to make this as broad as possible for now is just change that date time And then be aware of your folks who will be leaving the county for essential purposes like,
Well, that's why I would still want to leave in. I mean, when you leave in the words when you say for a non-essential business or operation or purpose, you could say business operation or purpose. I mean, you can still leave to go to work. I mean,
Right.
and you're not in violation of this
Right.
then.
If I
mean,
could suggest-
So basically it does what Patrick's saying in that when you say, and he wants to, limit travel, and I think limited travel is a good thing. I mean, we all should try to stay home at this point in time, but that's going to limit. I'm going to sit here and think about, well, gee whiz, if I leave here for 3 days and I'm not going for business or work somewhere, when I come back, I've got to be quarantined for 14 days. I'm going to think twice about whether I'm going to wherever I'm going and whether that's important.
if you wanted then to take a look at your page 11, the first line of the paragraph where it says residents returning, if you had changed the caption there to, if you're, sounds like you're coming to 3 days in the underlined bold print, if you went to 3 there, but then at the end of the first line, after the word absence, where it says after an absence, and then you insert there for non-essential travel. That's the only phrase you have to change to get it to require self-quarantining for an absence of more than 3 days for non-essential purpose, okay? For non-essential travel. Non-essential travel is defined in your proclamation by definition.
Right. I saw. Okay.
By exclusive definition, we describe what essential travel is. Everything that's not essential travel is non-essential travel.
Okay.
Just remember too that Lindsay pointed out that a lot of people will be visiting their family over Easter, and they may be leaving to go out for, probably.
Of course.
3 or 4, maybe 4 or 5 days. They might take an extra day or something like that. So I guess that would be considered essential if you go see family.
That's not going to meet an essential travel definition. But the fact is that the people who are going to travel for,
I would like to put in there also funeral services.
it's covered by permitted activities. Permitted activity number 22.
Oh, I was on page 10 of your,
No, on page
Page 11.
page 10.
up on top. Okay, I see it now. I was looking under the essential travel section you had here on page 10, so that's covered under the broad language. Okay. Yeah, I thought I saw that earlier.
Okay, is everybody okay with that then, 3 days?
I'm fine with that. I mean, that should give enough time if people are visiting or whatever, We're making folks do that has loved ones in the nursing homes and other places, that like to see their family as well. So unfortunately, we don't want to do any of this. I wish we wasn't even having this discussion, but we are. So we've got to take every precaution we can to keep the spread down, so.
Hey, what about is it okay if I move on to the effective date? Is that?
I think under rules for hotels and short-term lodging, we've got the question of whether right now it's written leases for less than 1 month, and then we got in parentheses, this might get changed to 15 days. So I think we need to
You got to
discuss whether
decide
we
what that
want
wants
that
to be.
when I was reviewing this, I suggested 15 days and not a month. And, one of the reasons is, we certainly want to prohibit travel here for people who are escaping areas that are
That's right.
hotbeds. And so if 30 days is just going to knock out about everything, but 15 days, I don't expect that people would come here and stay less than, I think they would want to come and stay less than 15 days, and they're not going to stay and pay for 15 days to stay here just to escape. And if they do stay for 15 days, then that meets the 14 days, and then they've got to abide by the rules that we have in place anyway. And nothing that they're doing here is essential.
Right.
except going to the grocery store. I mean, you know, but I don't see how you stop that altogether. But I thought the 30 days was a little excessive.
Yeah, I agree.
And I wanted to make sure that the lodging facilities included the Airbnbs. And, you know, I appreciate Lynn doing that work, but, you know, Lynn and I, we're both on the TDA board, and there's 1,000 of those Airbnbs out there. So we got 22 responses to this question. So
What about inserting?
if I'm renting to somebody I shouldn't be renting to, I'm probably not even going to respond.
To make that really
Right.
explicit then, how about on that, we're on page 11, rules for hotels and short-term lodging. After the words including campgrounds, if you inserted including campgrounds and direct reservation facilities, and then I'll insert after that, such as Airbnb. And then that gets them, we're making it brutally explicit that they're covered by this.
Okay.
I think they are a lodging facility anyway.
I
in the
think
first
so
thing,
too, but
a lot of them don't think of themselves as being lodging facilities. So just be super clear. Otherwise, you'll end up driving leisure travelers into Airbnbs, and you've defeated the purpose of reducing that vector.
Well, I think that's all of our concerns. The discussion is around protecting our residents here, protecting our people.
Yeah.
And, you know, if there's people on the road now maybe trying to escape some of these hot spots,
I think
and all the counties around us have already implemented some form of this. And we don't want to, we love people, don't get me wrong, but, you know, we don't want to be a hotbed ourselves here in a couple of weeks because we've injected a whole lot of people from other areas that may be carriers of this. So that's what we want to try to accomplish, is try to limit and stop this from coming in.
We're going to change that to 15 days.
I mean, you can't prohibit everything. I mean, there's no way you can prohibit
Yeah.
everything or stop this. But, you know, I think that we do an injustice to our citizens if we don't do what we can do to do our part of controlling it and to keeping it out. I'm not as concerned about Haywood County. And I noticed that, you know, Frank, you'd said, well, we do have it, but I don't know that we have it. We don't have a case. We not have a confirmed case, but that doesn't mean that it doesn't mean it's here. It doesn't mean it's not here, honestly, by not having a confirmed case. But unless there is one that I don't know about that's been confirmed. But, you know, and I think people, from what I have seen over the last week, are doing a pretty good job
Yeah, I agree.
without this. But I just think it enforces what the folks here need to do, and it keeps people out. I'm more concerned about somebody coming here and giving it to someone else in this community and then us having community spread. That's more of what I'm concerned about and what I want to do by trying to keep folks out of the county. I mean, you can't stop people from coming, but at least you can put some things in place to notify us that they are here, where they came from, and how they got here, and maybe we can control it somewhat. But if you don't put anything in place, then basically you're just saying, well,
Come on in.
Come on in.
Well,
and I don't think we want that.
What an ordinance like this is doing, like any ordinance that is controlling the behavior of people, is articulating what the social norm is. That is what the expectations of the community are for your behavior. In the same way that we enforce all kinds of other social norms by the laws that we pass, this is articulating and publicizing to the community what the expectation of their neighbors are for their behavior. Now, there's a whole lot of folks, me one of them, who don't like to be told what they should do. And what this ordinance does is articulates to us hardheads what our neighbors expect of us, to reduce the spread of this, to slow it down so that our healthcare system can be ramped up to be able to fight the virus. The virus is here, the virus is coming, the virus is absolutely, if you look at the map of the North Carolina Department of Health and Human Services, there's a little pooch down of Haywood County, but in Buncombe, in Jackson, in Transylvania, all the counties around us, they have the cases. We've got cases, we just don't know it yet. And so when we articulate the expectations of ourselves to our neighbors, that's what the ordinance is doing. And that's what puts us together instead of apart. I'll cease preaching at this point. And if you want to get any more change in the language, let me know.
I have something, Kevin. I went out yesterday evening and was walking around the track in Canton, and I know we're closing playgrounds per se, but I haven't seen the one up here in Waynesville. But we need to consider the parks as a whole. There was probably 15, 18 guys down there playing pickup basketball between 4 courts.
I think it's in there.
I don't know.
In there.
I know it spells out that you can go to parks. The playgrounds themselves are closed, but it doesn't specify if they wanted to get together and go to Allen's Creek and play soccer. I don't see that in there where they can't do that.
Well, I think where that's covered, it ain't in there specifically. It allows outdoor recreation, but it does say that they still have to stay 6 foot apart.
And playgrounds are shut down. I did read that.
Playgrounds.
Yeah.
But he's talking about like,
I'm talking about like the ball. I'm sure the
Basketball.
skate park up here is probably the same way. It's supposed to be 80 degrees by the weekend. There's going to be a lot of people that are going to take advantage of the fact that they don't have to go to work. And this is going to be the next thing to be able to hang out. And we haven't told them in plain English that you can't do that.
Well, I think that would not be an essential.
Well, it specifically says in there that you can't, that playgrounds are closed, but it doesn't say parks. We're allowing people, and most of these are individual sports, the hiking and the fishing and golfing and all, you've got your distancing and that's easy to do. But if you're doing any kind of a contact anything, it's not spelled out in there that you can't do that.
Well, actually, we lead in repeatedly in the ordinance to being in public, enforcing social distancing rules. So if people can be in a place where they have a right to be, but they're instructed to follow the social distancing rules. And obviously you can't play basketball, you can't play any kind of thing like that. You can't play pickleball, but all those places are closed already. The outdoor places are the ones that you have to articulate to these folks what the rules are.
Short of having it to where the town of Canton could go rope it off, that's really the only way you're going to keep people from going in there and doing that. Same way with Waynesville. I don't know how you would control that. I'm not familiar enough with Waynesville's rec parks.
Well, all those are closed now. The only thing that's open is the outdoor track.
I was on a conference call with some towns that operate, jungle gyms and things like that. And they've closed them down. They don't have fences around them. So they're looking for voluntary compliance, but just in case people are going, they're using bleach to clean the bars and slides and things like that daily. But I mean, that's certainly a risk. Our institutions aren't prepared for pandemics. I mean, that shows where we have weak points, and jungle gyms and slides, swing sets are those kinds of things.
You're always going to have a certain element of the population that's going to do whatever they think they can get away with. That's always going to be there.
Yeah.
But
I think Patrick hit it right. It's suppression. Stay at home. Distance yourself away from those things, because somebody wants to go there, they're jeopardizing their health and everybody around them.
Well, I can tell you, I don't like government control either. But we have to put these things out there. Like you said, just to allow people to know what's accepted, what's socially acceptable in a time like this. And we need to, practice all these measures. I'm an eternal optimist. I read data where they say 80% of people that get this, just like a common cold, and you're okay sitting at the house and isolating yourself, and you get over it. 15% require a little more extensive medical treatment, 5% get hospitalized. And as more testing takes place, the death rate and the testing kind of proves that the number is coming down closer to the seasonal flu as we talk. So I'm an optimist. I think this thing will blow over. It'll pass. We do this. These measures are working. Our public needs to know that they need to do these things. This thing will pass. And I can remember Gene Kranz. He used to be mission control guy, Apollo 13. Kind of a dark day. We had 3 astronauts trying to get back, and everybody thought they were gone. And he was asked, what were people like in mission control? And he said, well, there were some people that just panicked, just pure old panic. But Gene Kranz, he said, my answer was, did they panic? And he said, I told them, no. When bad things happened, we just calmly laid out the options, and failure was not one of them. We never panicked, and we never gave up on finding a solution. The people that was in the core of that situation never panicked. Other people did, other people around that situation, but we don't need to panic. We need to work the plan, and we'll get through this. And these are just some hard steps that we're going to have to endure, and I think people understand that. So none of us like it, but it'll pass. Yeah.
Yeah, that's exactly right, Tommy. So do we need to put parks in
Well,
there?
it's on page 3, and that's what I was wondering if we needed. It specifically says the play centers and rec centers, of course, are already closed, but if you put something in there for team or contact sports, specifically, it would spell it out to where people would know they couldn't do that.
So put in, you'd like for us to add parks there?
Well, we could either do parks, or we could do team sports or contact sports as opposed to using parks.
Okay.
I don't know how you would restrict it, but it needs to be in there to where they could be dispersed without, if it happened, they could be dispersed.
Yeah.
And it would give law enforcement or whoever's going to have to handle that the ability to say, hey, we didn't do this. The county did this, and it says you can't do team sports or contact sports.
Okay, well, let's just add team contact sports then.
What page are you on, Mark?
Number
3
3 at the very top.
Okay.
Just add team contact sports. Is that okay?
Works for me.
Because you're right.
Insert after the word gather
Insert what?
on the first line of page 3, all places of public amusement where people may gather. If you insert including team and contact sports.
Okay.
And then you can resume the phrase there, whether indoors or outdoors, whatever.
Okay.
Okay.
Sounds good. That's good. That's good, Mark. That's good. Okay, so.
That was all I had.
Okay. So as far as the date to go in effect, that would be, I just throw out Friday at 5, but what do y'all think about that? It's just so we can start talking.
I think we should tighten it down, and I know there's going to be some enforcement part of it, and some people are going to be upset, but you could be here from Florida, New York, or anywhere in 24 hours. If you knew this was coming into place, a lot of people that ordinarily would be covered by this could still come, make a reservation, and still be here in North Carolina in Haywood County by 5 o'clock on Friday. I mean,
Okay,
I think
so-
we should make it effective sometime today.
Okay, 5
If we
o'clock
wanted to do this afternoon, midnight, that's going to limit a lot of that from being able to happen. And some of it may already be in place. I got a message from someone yesterday that was saying that a friend of theirs was coming here from Florida specifically to get away. So they were planning on being here this weekend.
Let's be clear that it won't prohibit people who are coming here to stay in their own home. All the issues that you're doing with your start time is going to basically be an effect on businesses that, well, I don't express an opinion about there's no legal issue about it. It's just a matter of
Well, you know, after 5 o'clock yesterday, after the governor's proclamation went into effect, there's very little, really very little this is going to affect in some aspects. And this sheet here, what residents can still do, I mean, you can still live your life. Go to the grocery store, get your groceries, go to the pharmacy, pick up medications, visit healthcare facilities, go to the restaurant for takeout, drive-through service. You know, it's not really going to change a whole lot, but, you know, people are already doing. So.
Well, keeping the
Other than
people from
short-term
having time to get here.
Except for short of that, yeah.
Yeah, keeping people from having time to get here is kind of like WLS says it's going to snow, and by 5 o'clock this afternoon, there won't be any bread. This is kind of the same thing. If people hear it's coming tomorrow, they'll be here today or as quickly as they can drive here. It's not going to affect our people. It's going to affect the people coming here.
Okay, so what time?
I say 5 o'clock today.
I'm good with that. I mean, 5 o'clock today is fine with me.
Okay.
Is Joey here? Is he going to put this on the county website and the
They're filming it right now.
Facebook page?
It's live
Yeah.
right now.
It's live now.
You going to put
live
that,
on
you going to
Facebook
put this
right now.
on the Facebook page, on the county website? Thank you.
And one other thing to add there, if I may, I've been contacted by several folks that are on social media. And what they've been asking is that we put a lot of this stuff out. And what I've learned in the last day is it is actually on Facebook. So if you go to our Haywood Facebook page, you'll see some updates that's being updated along with, I understand we're live streaming right now. So I know that a couple of the fellow commissioners along with myself have put it on our personal pages as well. So I think social media is a good way to get this information out, along with our newspapers and the TV and YouTube. So
I'd like to back up what Commissioner Rogers said. Our Haywood County, NorthCarolina.gov website, the red button that Joey put up on the top, it's got just about everything that any resident, and I know the team's putting input on that, but there's just about every bit of information that you could possibly want to have on Haywood County, NorthCarolina.gov. So if you'll go there, the red coronavirus button up top, it's just a wealth of information for everybody.
found it on there yesterday.
Okay. Did you want to say something, man? You need to come up to the microphone and identify yourself.
I'm Carla Wood, citizen resident of Haywood County. And while this may be futile, I actually believe that in these times it is hard perhaps to not do anything. And I would ask that all of you not enact any further restrictions on your citizens. The idea that by enacting this, you would turn neighbor against neighbor and turn your neighbors into criminals is actually more than I can bear. The Constitution is pretty important to me. I swore allegiance to it when I was an officer in the United States Army, and I swore to it again to defend the Constitution when I became an attorney. I see these inroads as extremely invasive of our personal freedoms and rights. I also believe it is the wrong way to act I believe the correct way is to be proactive and setting things up for people, setting things in place, setting protocols in workplaces, schools, churches that help protect. Many of the people that I know do not support these actions. I, of course, this was an emergency meeting, so I just learned about it from a friend who posted something. Actually, they had to text me because I stopped looking at Facebook. Everything was so bad. So I just learned about it, dropped everything, and came here to speak to you. I know that my opinion may seem unpopular, but perhaps it is the unpopular opinion that is not being heard.
Thank you.
This virus is something that actually needs to spread. It's going to spread. And I don't see the need for this board, for this county, to place any further restrictions on our people and our citizens. It's not necessary. To quote you, it shall pass. It's going to pass, whether you all pass this proclamation or whatever you are calling it, regardless. Sometimes the harder stance is to say, no, I'm not going to criminalize my citizenry. Thank you for letting me speak.
Thank you for coming. Okay, is there a all right, so we've talked, so you're talking about 5 o'clock today. In effect, 5 o'clock today, and in the lodging, we're doing 15 days. And then how long would this emergency declaration stay in effect?
The text of it now recites April the 16th,
Okay,
but you can make it any number you want. That date just came from the Mecklenburg Declaration. So if you wanted to just be, if you wanted to, I don't know of anything else that none of the other proclamations have much shorter dates than that now. You might want to go 30 days and then, because you can always amend it by action of the chair later.
Well, I think if we go shorter than that, the people that are getting infected now, we don't even know the results on. They're just going to be finishing up their quarantine. And we won't know the new cases until people are circulating. 30 days, I think, is reasonable.
say 30 days.
I think 30 days would be reasonable. That way everybody kind of knows what's going on and we know where we're at. And if it looks like this is over and passes very quickly, we can always pull back in and say, okay, we don't need it anymore. But I think it's going to be the other way around. It's kind of like school system canceling for just a couple of weeks and then turning around and moving it. I think we're not going to know until 30 days where we're at.
Patrick, do you have an opinion on how long we should enact this? Do you have an opinion on how long we should enact this?
When I looked at it first time, for the length of time for this,
Yeah.
a 3-week time was what I looked at first. When you do, the first thing that the first slide he had was, he mentioned time. Here's what I would like to say about our options here. First of all, what are our options? We started out with non-pharmaceutical interventions, the hand washing, et cetera. We moved on to social distancing. Now we're talking about suppression. So if we're going to fight, we should fight hard. And what matters most now is time, and that's what Frank mentioned. Time is what matters most right now. The Italy model is what we don't want to model, essentially. They did nothing. So we have no cases. What Kirk mentioned, I do believe there are cases here. We had 89 tested. We have, I should have brought it with me. I think 51 negatives and 25 essentially, or that might be reversed, is still awaiting results. And we actively tested a number yesterday, and we tested this morning that I know about. We have people traveling here. We're going to have cases. And so what happens is you have a case, and then you have a community transmission if we're not careful. 1 case equals 2, 2 equals 4, 4 equals 16. What we need to do is get the first case, do very careful contact tracing and quarantining to try to suppress community transmission. So to answer your question, if you give us at least 2 weeks, and Greg and I and the Policy Council at least see how suppression works, at least 2 weeks. 3 weeks, what we put in there originally was what I saw. When you do suppression, it's painful for people. I understand that. This is going to be painful, and so it's up to you. But 2 weeks, the more you suppress right now, the less impact on disease and the healthcare system we are going to see.
So we have the 16th, which is 3 weeks from today, on it.
Why not?
And if Patrick's saying 2 weeks, but 3 weeks would be good, I would rather not put this in place any longer.
That's a federal, when we're under a state of emergency, that is considered essential, so.
Well, the federal, actually, the state law that gives authority to the counties and the state to impose emergency management activities, specifically, the state law prohibits restricting access to guns and ammunition. So you don't have the authority, you don't have the legal authority. The county has no legal authority to limit access to legal guns and ammunition.
And we weren't going to do that. I just want everybody to know that they are still open and running. So, in case, they had other ideas. Okay, so does anybody have any other questions?
Just another comment, just mentioning the gun and ammunition stores and closing the trails and stuff. I do appreciate Ms. Wood coming and speaking. I am a big believer in our freedoms and our rights myself, and this has been really, really tough on me, especially having to make some of these decisions to tell our folks what to do and what not to do. Like Kevin said, I know there's a lot of folks out there that have wanted us to do it, and they're the people that normally tell us to have less government and tell them what to do. So it's been a struggle for me, but on the same hand, I understand that this is something that we need to do, is take some measures to protect our citizens in Haywood County, and it is going to be temporarily. So hopefully this will pass soon and we'll get back to normal. But I just wanted to make those comments. I appreciate Ms. Wood coming and saying what she did, because I'm a believer like she is in our freedoms and our rights and our constitutional rights. But I believe this is necessary.
I'd like to comment too and just say, hey, this will pass. And a couple of weeks, good Lord being on our side and weather warms up, I'm an optimist. I think we may find out this has been here maybe a little longer than we think it has. I don't know. This thing changes every day. And so we're not really doing anything. It didn't happen yesterday at 5 o'clock. If you read this document, all your essential services, folks out there watching, listening, your power company workers, your phone company workers, your grocery stores open. Maybe you'll learn how to cut your own hair at home. But for the most part, all your essential services, we're still going to go, and we just need to practice all the precautions that Dr. Johnson has put before us. Well, we've preached that so many times. I think everybody probably knows them by heart. Practice social distancing, cover your cough, wash your hands frequently for 20 seconds, monitor your temperature. I mean, you can go down the list, and these things work. And I think the flu epidemic, the flu problems we had here, I said it last meeting, I think that has prepared our citizenry to be more conscious of those things. I think it's helped us. And thankfully, you know, we don't have a case right now, but we may have one soon. But, hey, it's not the end of the world, guys. Let's keep moving. Let's keep living. And be careful, practice all these precautions, and we'll get through this.
Wash your hands.
Yeah.
I appreciate what Kirk kind of brought it to, when you have 20 ventilators at the hospital, that brings it all to, kind of puts it right there where we're at. So I appreciate those comments, Kirk. That's exactly right. And that's what we're trying to prevent. Okay, so I'll entertain a motion that we approve the amendment to the Haywood County Proclamation of a State of Emergency that we've discussed, and it's in this document that we've all been discussing. Is that proper motion?
Yeah,
With the
some
notated
other-
changes
yeah.
that we've agreed to.
So moved.
Motion, is there a second?
Second.
Any other discussion? No? All those in favor indicate by saying aye. Anyone opposed? Okay, that's unanimous. And I want to thank, and our county does have no cases at this time. We want to keep it that way, but I'm sure it probably will change. I want to thank Frank and Tracy. I know Frank's spent a lot of time on this ordinance, and I appreciate Frank coming in and doing that. I want to thank Tracy and Bryant because they've fielded a bunch of calls and had to answer stuff. And Patrick is really staying on top of it for us. I appreciate all Patrick's done. And Ira has been able to, I've had to call Ira a whole lot to get him in touch with people to answer their questions, because we're all plowing new ground. And I think that our sheriff and Greg Christopher and his staff and Greg Sheepin and the emergency management staff, and they've kept us, kind of, we're planned, we're ready for this now. And I appreciate all that work and background. And Lindsay and Joey have done a good job. Lindsay Regner and Joey Webb has done a good job of getting the word out and our media contacts. I also want to thank Julie and Chris and David, our county staff, for all that they've done. I know Chris has had to really find products to keep everything wiped down. I mean, when you think you can't find it, just think how we're trying to find supplies to do things and to wipe down a lot of buildings and not just your home. So they've done a good job doing that. And I thank Lynn again for the information that Lynn Collins brought for our to look at today, considering the lodging. And I also want to thank our media partners that are here today, Smoky Mountain News, Mountaineer, and WLOS. And I appreciate y'all coming today and to report on this and get the word out to our citizens. And I thank y'all for y'all doing that. I know you've put the word out on your websites, and it's easy to get to. And then Joey has got a tab on our page that you just click the red button and you can get all the up-to-date information. They're also putting this out on Facebook. If you have a Facebook account, a lot of people like to get on Facebook, and instead of starting a room where you can go to the source, Haywood County has a Facebook page where you can find out what the facts are. We also have our website where you can get the facts. So instead of spreading rumors on Facebook, if you want to find out what's going on, just consult the county website or Facebook page and you can find out exactly what's going on. That we keep that updated. As soon as we get information, we update it. So I want everybody to understand that and look for that. Is anything, okay, so is there anything else this morning? Okay, all right, so I'll entertain a motion to adjourn.
So moved.
Okay, all those in favor, indicate by saying aye. Aye. Okay, we're adjourned. Thank y'all.